Hello, my name is Jesse Henry, and today I'm presenting the physiological reasons for chronic illness in long term alcoholics. This topic can sound daunting, so I wanted to break it down and define three key terms. These are terms that you should know. Physiology is defined as a branch of biology that deals with the functions and activities of life or of living matter, such as organs, tissues, or cells, and of the physical and chemical phenomena involved. The second key term is chronic. Chronic is defined as continuing or occurring again and again for a long period of time. And then the key term that's probably most familiar to all of us, but I just wanted to break it down as part of this title, was alcoholic. Alcoholic is defined as a person who has been affected by alcoholism. Now, there are a multitude of unintended consequences when you're talking about alcoholism, but we're going to focus on consequences as they relate to physiology, just as the overall theme for today's presentation. Now, these five consequences include liver disease, pancreatitis, cancer, immune system dysfunction, and brain damage. We're going to start with the first medical consequence that I mentioned, which is liver disease. There are three types of alcohol related liver disease, and those are fatty liver, which unfortunately, abstinence from alcohol is the only way to reverse fatty liver. And as I mentioned earlier, alcoholics are affected by alcoholism, which can really make that abstinence from alcohol extremely challenging. Then there is alcoholic hepatitis. Alcoholic hepatitis has varying results when attempting to reverse. It is sometimes successful. And then you have cirrhosis of the liver. Unfortunately, cirrhosis of the liver is generally irreversible. You'll see the table at the bottom, alcohol content by type of alcoholic beverage. This table shows you the proper serving size for beer, wine, and liquor that would equal 14 grams of alcohol. You can see that some of these beverages require a much smaller amount to be equivalent to that 14 grams of alcohol. For example, liquor only takes 1.5 ounces to equal the same amount of alcohol that's in a 12-ounce beer. Our next medical consequence to alcoholism is pancreatitis. The definition, as defined by Columbia University Irving Medical Center, is a condition in which digestive enzymes that are typically activated in the small intestine instead become active in the pancreas. Pancreatitis can either be chronic, which is long term, or acute, which could be a sudden onset. Symptoms of pancreatitis include symptoms such as severe, steady pain in the upper to middle part of the abdomen that can sometimes spread to the back and shoulders, low-grade fevers, nausea or vomiting, low blood pressure, and sometimes clammy skin. If not properly treated, acute pancreatitis can become a serious and even life-threatening condition. Thankfully, however, with proper treatment, most patients are able to recover from acute attacks and avoid serious complications. But even after a patient recovers, additional steps are usually needed to address the root cause of the pancreatitis. If alcohol abuse is the underlying cause, which is our general theme today, doctors will recommend that the patient completely eliminate alcohol consumption. After an acute attack of pancreatitis, continued alcohol consumption is dangerous and can lead to future attacks and the development of chronic pancreatitis. As we mentioned, chronic is long-term, ongoing pancreatitis. Us on to cancer. Yes, alcohol can cause cancer. In fact, there are at least 7 types of cancer that are linked to alcohol consumption. The first 4 are the mouth, throat, voice box, and esophagus. Alcohol use is linked to increase these 4 types of cancer. The reason being is alcohol limits the ability of the cells to repair damage to the DNA. And alcohol acts as an irritant, especially in the mouth and throat. So these cells that are damaged by that alcohol could try to repair themselves, which could lead to DNA changes that could potentially be a step toward cancer. Then you also have the colon and rectal cancer. Alcohol use is linked to colon cancer, but it is most prevalent in men. However, women have been diagnosed due to alcohol-related purposes also. And then you have breast cancer. Alcohol use is known to raise estrogen levels, which is linked to an increased risk of breast cancer. Now, it is important to note that all alcohol contains ethanol. So whether you drink beer, wine, or liquor, you are still at risk. If you recall the recommended serving size for beer, wine, and liquor from the liver disease slide earlier, you'll remember that it is recommended that 14 grams is that serving size. Now, it is also recommended that women are not to exceed 1 serving, which is that 14 grams, and men should not exceed 2 servings, so a total of 28 grams. We're going to move to our immune system dysfunctions. Immune systems do have an adverse reaction or adverse effect to the chronic use of alcohol. What happens is alcohol interferes with the chemical signals from white blood cells called cytokines, which can cause an autoimmune response if produced in larger than normal quantities, or an immune system deficiency in cases when these levels are actually decreased. So that decrease in white blood cells due to alcohol consumption results in diseases such as pneumonia, tuberculosis, human immunodeficiency virus, more commonly known as HIV, hepatitis B and C, autoimmune diseases, leaky gut syndrome, which is when bacteria from your bowels seep through the walls of the intestines, and then cancer, which we just recently discussed, those 7 types of cancer that are linked to alcohol use. So this brings... It's important to realize that brain damage symptoms can be similar to the traits that are often associated with just drinking a couple of alcoholic beverages on a weekend night. But brain damage happens over time, whereas just, that impairment from a couple of beverages can and typically is resolved with time when you quit drinking and achieve sobriety. Unfortunately, that isn't a possibility with brain damage. Common symptoms of brain damage include blurred vision, slow reaction times, or poor motor skills. So things such as opening a jar or, trying to turn a doorknob, those can become a challenge. Impaired memory, oftentimes just total blackouts, and then slurred speech. Like I mentioned, you'll notice these symptoms really resemble the symptoms of being intoxicated or under the influence. But it's vital that you recognize that these symptoms of brain damage are a result of long term effects. The factors that influence brain damage as a result of alcohol include things such as how much and how often a person drinks, the age when they began drinking, and how long they have consistently drank. The demographics of that person, including things such as their age, gender, education level, and then family history of alcoholism. And something to consider, such as was that person at risk because of being exposed to prenatal alcohol? And then, of course, just the person's overall general health or well being. These types of factors can really determine whether brain damage is a result of alcohol or something else. You'll see the image that I've put on this slide, the schematic drawing of the human brain. This shows the regions of the brain that are more susceptible or vulnerable to alcohol-related defects or damages. So it is important to notice those things. As a result of my research, it is important, and I would be remiss if I didn't state that alcohol use in high quantities, in excess, and over long periods of time are detrimental to your health. So I would encourage you as a peer to really drink in moderation.